Thank you, Honorable Minister, Chair, Honorable Ministers. Thanks again, ladies and gentlemen of the press. Thanks again for this opportunity. I'd like to start from where the Honorable Minister stopped and really focus that we're really trying to change our strategy now and test more people. The testing capacity in our labs has increased. The bottleneck now is getting the samples from the right people. So we're setting up 20 healthcare facilities in Lagos, supporting Lagos in doing this. This is done by the government of Lagos State to collect samples from people that think they have an acute respiratory infection, have fever, have samples, and want to go to a healthcare facility. We're intensifying our surveillance in healthcare centers, so hospitals around Lagos and the FCT, to collect samples from people with an acute respiratory infection. In Abuja, certain communities, we're going door to door to collect samples from people that have an acute respiratory infection. We're doing the same in Lagos. So in these two states where there's a high incidence of infection, we're now strengthening our surveillance and going to the patient to collect these samples. The call centers have improved dramatically, so we're also urging members of the public that think they have an acute respiratory infection to call us. We will send a team. Please don't go yourself. If you're going, go to one of these 20. Don't go to any other center. We will announce them as they're set up. Lagos State will announce them and then make them accessible to everyone. The key topic I've picked today, like you would have noticed from what I'm wearing, is the topic of masks. This has been a controversial issue, but actually it doesn't need to be controversial. First let's start from some basics. The number of cases across the world has really risen to over 2 million. So we really have to imagine 2 million cases, over 100,000 deaths of a disease that none of us knew about 4 months ago. So the scale of the disease and the outbreak and the scale of the response has to radically increase. Science is evolving every day. We're making new discoveries in terms of how to manage various aspects, and the aspects of mass is just one of them. On the other hand, there's a reality that we face. There's a chronic global shortage of personal protective equipment, including masks, around the world. Everybody is looking for the same thing. The world was not prepared for a pandemic of this scale. So we have to prioritize certain parts of our population. 50% of all the masks in the world are produced in one country, China, that has been locked down for months. They're now restarting their production, and thankfully some of those things are coming out. A lot of the PPEs are produced in countries that need it themselves, so have themselves banned the exportation of a lot of these things, including masks. So the demand is very high, and even with a lot of resources, a country like Nigeria is not able to meet the demands of everyone. So there's no way we can supply masks to everybody in Nigeria right now. So we've had to come up with a policy that is pragmatic. And if you have seen this policy, it's been on our website for a few days now. I hope you've all read it and digested. We have 5 key recommendations. I'll actually recommend that website to anyone that wants to find out about specific things about the response. So I'll crave your indulgence and read the 5 recommendations because they're very important. 1, the wearing of masks or equivalent is recommended as an optional additional layer in addition to measures like social distancing, physical distancing, hand and respiratory hygiene measures. So these masks, like the Honorable Minister rightly said, is not to be done in replacement of, but in addition to all the other measures that we have recommended in the past. However, it is critical that we learn how to properly put on the masks and take them up by their hands. Once you touch the mask, especially when you touch the inside surface of the mask, that's exactly where we don't need you touching, because that's exactly where the viruses that we exhale are. So please, what we call the donning and doffing, the putting on and off of masks, is probably more important sometimes than the wearing of masks, in order not to increase the risk. When we say improvised masks are an option, they are an option. But they're not an option if you're going to wear the same cloth mask every day for the next month. You have to wash these as frequently as you can possibly do, at least once a day, for it to make any sense at all. And this is the advice for people that are not working in the medical field. The usage of masks, number 2, is particularly important if you have to attend a large mass gathering, which are very few now, if you want to go to the market, to the mall. And, the science behind this is, the evidence that we have at the moment is the mask is much more protects those people that have the disease, might be at early stages of it, or asymptomatic from spreading. So it's very important that if you're in a mass gathering, in order to protect others, in a situation where you may have the disease, that you wear a mask. Now, one key thing is we're asking that all public sector resources be reserved for procuring masks for people working in the health sector. So we're really appealing to the state governments across the country. If you have extra funds to procure PPEs, please use it first to satisfy the need in your hospitals and your clinics before you start procuring masks for everyone. Let us protect the most important people in this war, the people on the front lines. So really, we are trying very hard to meet the demands of healthcare workers and prioritize them. Like I said, the wearing of mask, number 4, will not protect against COVID-19 unless it is combined with other measures like physical distancing, hand washing, respiratory hygiene. And finally, that we particularly recommend this for senior citizens, age over 60 at least, especially those that have hypertension, diabetes. Many of us have this. We live more or less comfortably with this, but the fact is that we are an additional risk of having a severe incidence of this disease, so we'd like to offer that additional level of protection. So to conclude, we have ensured so far that we meet the demands of hospitals across the country in terms of their PPE needs, and states we've distributed, and in some cases like the Jack Ma donation, actually made completely public who has received what. We made this public on our website in detail, what state has received what, obviously prioritizing the states that have the most cases. We're really looking for local manufacturers of this to procure from them. So every hand sanitizer procured by the federal government now is supplied by a local manufacturer. As far as I know, everything we buy at NCDC is supplied by a local manufacturer. So there is an opportunity for industry to scale up their ability to produce masks, the protective equipment that we wear, as long as it meets the safety requirements that we have. So really, this is an opportunity. In every crisis, there will be an opportunity. This is one to really scale, and I have a feeling that the need for PPEs will change forever in our country. And so if you develop a production line, this will be a great business to be in, so we can solve 2 problems, one of the healthcare sector and also support the economy. If we do this, those people that are right now hoarding masks, and there are many of them, will let go of them, because industry needs to respond. If industry can respond to our needs right now, we'll put out of business all those people keeping masks, waiting for prices to go up even further. And that is really our goal. We want to do the right thing. We want to support the Nigerian economy and grow as we keep ourselves fit. So if you're a member of the public and you want to wear a mask, you don't have to wear a medical mask. In fact, we don't recommend the use of medical masks for members of the public. We recommend the use of improvised cloth masks to protect you if you insist. So thank you very much.